Today, we have with us the current scholar who's also one of our Knowledge Hub coordinator, Monika Gupta, who will be presenting on the topic Why Gender Matters in COVID-19 Response. I'm sure you all agree this topic is the need of the hour, and Monica will be highlighting facts, challenges, and solutions surrounding COVID-19 and gender. Monica is a 2019 split site scholar from India. She specializes in gender and diaspora studies, and through her work in the gender space, Monica hopes to improve the condition of young girls and women in her country. Monica is currently completing her PhD in South Asian Studies at SOAS, University of London, and Jawaharlal Nehru University. The format for today's webinar will include a presentation by the speaker, Monica, and which will be also followed by a question and answer session, which will last for around 10 to 15 minutes. You can use the chat function to send in your questions. If not, we can continue the discussions later on the group. So without further ado, I hope that you all enjoy the webinar, and I'm handing the presentation now over to Monica.
So thank you very much, Evangeline, for that introduction, and thank you, CSC, for providing this opportunity to interact with fellow scholars and alumni from the Knowledge Hubs and making our Knowledge Hubs more engaging platforms for discussion further. As introduced, I'm Monica, a CSC split site scholar from India, currently at SOAS, and today I'm going to speak on why does gender matter in COVID-19 response, basically presenting a gendered perspective to COVID-19. Presenting before you a very brief introduction to today's webinar. COVID-19 has put the nation states on the verge of insecurities, economic fallout, and made them extremely vulnerable to global challenges, including health, education, food security, unemployment, etc. In the recent conducted studies, it has been found that gender justice and equality should also be an important aspect of the pandemic stories because gender-sensitive issues get severe and worse during these crises, and that all stakeholders should address the issue with urgency, care, and commitment. In this context, this webinar intends to cover the following 5 dimensions of this crisis. The first part shall talk about why do we need to discuss COVID-19 and gender in the first place. Secondly, why are women suffering more than men during this pandemic? Third, different problems concerning women. Fourth, comparison of the developed and the developing world in the context of the impact it has had on the women. And lastly, we'll talk about solutions, challenges, and deliberations in the light of sustainable development goals. So to formally begin the presentation now, coming to the very first part, why do we need to talk about a gendered perspective to COVID-19? And the answers and reasons are many, but some of them I have summarized here. First, because there are huge risks that gender gaps could widen during and after the pandemic. It has been found that working mothers now spend more time than working fathers on childcare and household chores. Working from home have put enormous pressures on females who are either overloaded with work or have decided to quit their work completely. There are huge fears of increasing gender wage gaps, racial and ethnic economic gaps, and many more. At the same time, there's an immense fear that whatever progress we have achieved so far in terms of girls' education, female economic empowerment, health and reproductive rights might get reversed during this pandemic. We need to talk about a gendered perspective because experiences from the previous epidemics like Ebola, Zika have shown how it affected men and women differently and women more severely. A gendered lens is required because in conflict-prone zones and regions, this pandemic has made the survival more difficult for women. From health to economy, security to social protection, the impacts of COVID are immense for girls and women simply by virtue of their sex. And lastly, women's role in resolving the crisis cannot be ignored because of their presence in varied responsibilities, both inside and outside the house, and international frameworks, institutions, and organizations must recognize that their roles and contributions cannot be ignored while resolving the crisis. Moving further to another part of the presentation, why are women suffering more than men? To begin with, the World Bank report says, given that the COVID-19 is not gender blind, the response to it should not be either. At the same time, the statistics reveal that there is high mortality rates among men due to this pandemic. A Chinese study conducted suggests that the fatality rate among men with the virus was roughly 65% higher than it was among women. Despite these facts under consideration, why do various studies indicate women suffering more than men? Is it because of the pre-existing socioeconomic conditions? And the answer to it is yes, to a greater extent. We have seen and witnessed many times how a system fails women due to existing norms, rules, and regulations, making them highly vulnerable and pushing them to the margins. And this systemic failure gets worse during the crises like these. Reflecting upon some other reasons of why are women suffering more than men, according to the reports, women make up 70% of the workers in the health and the social sector. The image that you see now shows a share of women among all workers employed in health and social work for the year 2020, the two sectors which are severely hit by this pandemic. Since 70% of the women are now working in these sectors, there is overrepresentation existing, because of which they are more exposed to the health vulnerabilities in their roles as nurses, paramedics, family and home caregivers, teachers, childcare workers, and many more, because of which they are more exposed to the contagion and therefore are suffering more. Thus, we see there are more women in the client-facing roles as compared to men who are into logistics and security. Another reason that comes out of research is due to varied responsibilities inside the home, many women opt for temporary part-time jobs. And now, when the world is hit by economic slowdown, many are on the vulnerable positions of either losing their jobs or would have already lost one by now due to the economic instability. There are some other reasons as well, which I've summarized here from a sociocultural perspective. Since pandemic has restricted movements, the women in lockdown are not just restricted within their houses, but also within the walls of patriarchy, pressure, and pain, hinting us again at the pre-existing social conditions which has intensified during this pandemic, making women extremely vulnerable. Secondly, due to closure of schools and other services, women in their role as community caregivers are now experiencing greater interference and limitations in their work, social, and personal life. Talking in terms of the statistics, according to the World Bank Group report published in April 2020, due to the longer average life expectancy, more of the elderly are now women. The data says globally, women constitute 55% of the 65 plus population and 62% of the 80 plus population, an age group which is extremely vulnerable to this pandemic. Lastly, women are facing specific constraints in accessing healthcare services, and the case of pregnant women is an example of this. And I'll talk about this in details in my subsequent slides. Now coming to a very important part of this webinar, and the picture that you see on your slides now shows some major statistics concerning the problems that women are facing during the pandemic and it reflects an increase in the domestic, sexual, and gender-based violence globally. We can clearly see in the picture data from all across the world: France, Argentina, Cyprus, Singapore, UK, US, Germany. All of these countries have registered increase in the domestic violence cases. During the lockdown, women and children are forced to stay inside the houses with their violent partners and therefore become victims of domestic violence. These women are finding themselves isolated from the people and resources that can help them, and therefore there's an increase in the cases of domestic and gender-based violence, and it has become a major concern coming out of this pandemic, especially for women. Talking about some other problems, another problem that concerns women is in terms of financial instability and economic slowdown. The graph that you see now shows the share of employment currently at high risk of reduction in working hours, cuts to wages, and layoffs by SEX 2020. As you can see in the graph, it shows data for different parts of the world, including low-income countries, lower middle-income countries, upper middle-income, and high-income countries, and it clearly indicates that women are suffering more than men due to financial instability and economic slowdown. And the analysis also reflects a special case of single mothers who are severely impacted out of this pandemic. Reflecting upon some other problems that are concerning women particularly. To begin with, inadequate access to healthcare services during the pandemic. So social distancing and lockdowns have negatively affected women's access to medical care as COVID-19 cases takes precedence in hospitals. The healthcare services like prenatal and maternal care, access to contraceptives, safe abortions, all have been disrupted, and forced pregnancies is one of the outcomes of this. Another significant problem is girls' access to equal educational opportunities are hindered, particularly in developing countries, and the increase in the dropout rates of girls are a clear indication of this. When today the educational system moves online, particularly in developing and underdeveloped countries, girls and boys will not have equal access to necessary resources, equipments, basic infrastructure, and services. And in those cases, it is most likely that girls' education will be severely affected. Talking about some other problems, there is this concept of double shifts which have emerged out of this pandemic, where women are doing double shifts at their homes, that is, working from homes as well as managing household chores, thereby having no time for themselves, and which is severely impacting their mental health as well. Talking about the conflict-prone zones and regions, where women were already on the margins and were excluded from access to basic services and in their roles as decision makers, now during this pandemic, they have become more vulnerable to sexual abuse due to restricted support and services. At the same time, there is an increasing risk of early marriages among girls, especially in the lower income countries. So we see these are some wide-ranging problems concerning women during the pandemic. There are many more, but most of them in most of the cases, women are being severely impacted due to this pandemic. Coming to the next part of my presentation, which is a comparison of the developed and the developing world. The slide in front of you now shows how this pandemic has hit the developed and the developing parts of the world in the context of its women. So there's this report titled as Violence Against Women and Girls, Help Desk Research Report, published in March 2020. And it has certain important highlights that I would like to present before you. So it obviously comes up with the very first perspective in the case of rise in domestic violence. So in China, it has tripled during the pandemic, and Italy too has experienced rise in domestic violence cases. Secondly, domestic violence shelters are reaching capacity and are unable to take new victims due to lockdown. In many cases, these domestic violence shelters have been repurposed to serve as health centers or shelter for homeless people. In other countries like United States and Hong Kong, there's an increase in the abuse and exploitation of women. For instance, in the United States, there have been reports of more coercive and violent behavior against street-based sex workers in Seattle since the COVID outbreak began. Similarly, in Hong Kong, domestic workers are being made to work on their day offs since the government has advised to stay inside. There's also an increased risk of racial and sexual harassment in countries like UK, US, and India. For instance, in the United States, an agent wearing a face mask was attacked at the New York station, calling her deceased. Similarly, in Birmingham, UK, a woman was punched by a man on her face after she defended her Chinese friend from a racist corona attack. The similar cases have also been in India, where racist comments were passed on two female students from the northeastern part of the country. So we see how both the developed and the developing worlds have been severely impacted, and especially the conditions of women have become vulnerable. Another problem that's emerging is in the context of the lower income countries of Asia and sub-Saharan Africa, where there are households with small children and women with male as the only breadwinner. Now, due to high mortality rates among men due to COVID, women and children are left behind with no source of income and hence no means of livelihood. In order to present a more wider picture of the situation of the developed and the developing countries with respect to women, this slide and the graph that you see in front of you depicts an increased rise in the domestic violence cases in countries of Egypt, Kenya, Nigeria, South Africa, and Uganda. These are some countries randomly chosen which describe the increase in the domestic violence in different countries around the world from November 17, 2019 until May 3, 2020, divided significantly between three phases: the pre-COVID, spread of COVID, and the lockdown period. And you can clearly see the rise in the domestic violence cases during the lockdown period in almost all of the countries. And thus we can see how seriously this pandemic has hit women all across the world. Moving on to the next article in the context of the developed and the developing world. So now that the image that you see in front of you is in terms of how the countries have been able to deal with this pandemic. And in this context, there was this article doing rounds on the internet titled as "Why Are Women-Led Nations Doing Better with COVID-19? A case study of New Zealand, Germany, Finland, Norway, Taiwan, Denmark, and Iceland." The answer that this article comes up with is they are all under the leadership of women leaders, reflecting upon the role of women leaders in this pandemic and how women should not be left out of the decision-making processes, especially when it comes to governing a nation or a country. Therefore, I would reiterate myself and the point that I made earlier that women's role and contribution cannot be ignored in resolving this pandemic. Coming to another very interesting and important part of this presentation, way ahead solutions, challenges, and deliberations in the light of making this pandemic bearable for women. There are various ways in which all of us can contribute our share into this, and some of them I have summarized here. But before that, I would like to quote what the United Nations Women have to say. They say that parliaments have a bigger responsibility to respond to the COVID-19 pandemic with gender sensitivity. This is because times of crisis can lead to decisions being taken into haste without consideration of women's rights, experiences, and perspectives, especially when they are often omitted in decision making during the normal times. So now it's time when any decisions that we take should definitely have gender sensitive angle to it. Looking forward to some of the solutions and challenges, there is a strict need for effective mechanisms at local, national, and governmental levels. For instance, there's an urgent need to support these women who have been the victims of one or the other forms of sexual abuse. And for this, for example, women's shelters and other forms of support should be really strengthened. Secondly, the role of the civil society groups becomes really important in terms of acting as a bridge between the victims and the essential adequate services. There also has to be an effective use of technology in reaching out to women in need. For instance, it can be done by hosting live streamed workshops, publishing online manuals, creating posters, and many more. There's also a need for an intense, serious, and immediate provisions of mental health counseling to the women in need. Going through some interesting research, there was also this solution suggested that there is a need to include women and girls in community response mechanisms, which enables the beneficiaries and community members, in this case, young girls and women, to provide feedback and seek responses in relation to developmental activities in their communities. And not to forget, the role of the policymakers becomes really, really important, especially when they are drafting policies and formulating responses in the light of how this pandemic affects men and women differently and what can be the future course of action considering it. These were some major solutions. There are some other solutions as well, which I tried to summarize it here. There's an urgent need to increase social awareness, protection mechanisms, and support services for women survivors of violence. By including women in the mainstream decision-making roles for the prevention, detection, and surveillance of the infection, it can be a very good step in bringing women in the mainstream decision-making. It can also be done by prioritizing women on the front lines and maternity settings by providing them with adequate access to healthcare services. We also need to adopt measures to provide financial assistance to those young girls and women whose education has been affected due to this pandemic. And because of this financial assistance, they can resume their education. We also need to think broadly and take measures to support our female farmers in terms of, say, financial assistance or technology, and come up with ways like cash for work programs to generate female employment. So cash for work basically refers to initiatives where cash or vouchers for goods or services is directly provided to the beneficiaries. And these direct cash transfers provide a very flexible resource to the affected households and enables them to spend money according to their needs and priorities. Almost moving towards the last part of this presentation, where as per my research on gender perspective to COVID, I have come up with an analysis of what are the direct and the indirect targets in the light of SDGs. It is beyond any doubt that this pandemic has had an impact on all of the 17 SDGs that we have. But the top 3 direct and indirect targets, I have summarized it here. Talking about in terms of the direct targets, SDG 3 comes first, which is good health and well-being, and it calls for ensuring healthy lives and well-being at all ages. Next is SDG 5, which is gender equality, and it calls for ensuring empowerment of girls and women during the crisis. Lastly comes SDG 17, which is partnership for goals. And this is really very important because no country can move out of this pandemic situation alone. We need support and guidance from others, and therefore, international cooperation, solidarity, and partnership are significant to deal with this crisis. Similarly, talking about the indirect targets, SDG 4, quality education, SDG 8, decent work and economic growth, SDG 12, responsible consumption and production, are some other areas which should form the basis of any policy making or foreign policy initiatives of any country, be it developed or developing. With this, I would like to thank you all for patiently listening to it, and I would like to end it on a very positive and optimistic note that let us all be those women leaders rising in solidarity to save lives and protect livelihoods from COVID-19 pandemic. Thank you so much.
Thank you so much, Monika. So now we have the question and answer session. So please use the questions feature in GoTo. I'm not sure if you can. I've seen a few of the attendees comment when I asked initially if you can hear me. So you can use the same feature to send in your questions for our speaker, Monika. In the meantime, if we do not have a lot of questions coming in, do not worry. We will continue the conversation ahead in the Knowledge Hub group as well. We do have a question from Christopher, who said that it has been reported that twice as many men have been dying from the virus as women in the United States, Western Europe, and China. Do you think that men are equally much affected or even more affected by COVID-19 compared to women? Monika, I will wait for some more questions coming in, but I'm not sure if you want to take this question right now.
As you say, like, should I go ahead with this question now?
Yes, it sounds good. Yep.
Okay. So thank you very much, Christopher, for that question. Well, I do agree, and I highlighted this point in one of my initial slides, that the statistics clearly reveal that there are high mortality rates among men due to this pandemic. And the fatality rate is 65% higher than it is among women. But if you look around at different studies that are being conducted, you will clearly see that apart from this fact, there are various other pre-existing socioeconomic conditions which are making women vulnerable to this pandemic. So the kind of system that we deal with, the kind of system that we face daily, both inside the houses as well as outside, have made it more difficult for women to face this pandemic. I hope I've answered your question.
Okay, thank you so much, Monika, for that. While we do wait for a couple of more questions to come in, please do use the questions feature in the GoTo function to send in your questions. Out of curiosity, Monika, I just wanted to know, given your expertise in, within the gender space, what has been your experience so far through the researches you've been through and through the texts that you've read? What have you come across from your country perspective? Or you could say either Indian perspective or the Asian perspective. What do you think has happened so far within the gender space and COVID-19, and what do you think the measures that can be taken for this?
Yes, thank you, Evangeline, for raising that really interesting point. So first of all, I would like to say that before this pandemic, I would have, until this pandemic started, I would have never thought about that such crisis-like situation could severely impact women. Until now, my PhD deals with the identity and empowerment patterns of South Asian women in the UK. And as part of my research, I have tried to incorporate a lot of factors that might affect women and that might act as challenges for the women. But when this pandemic started, and when so much of research, so many research articles started coming up on internet, and these research clearly indicating that women are severely impacted by this crisis, not only because of the not only because of the front challenges that the pandemic poses, but also because of the already existing socioeconomic, socio-cultural conditions, that it's becoming really difficult for them to cope up with this pandemic. Talking in the context of my country, I come from India, and in Indian context, the helpline numbers that we have for women, there is a surge in the calls of the domestic violence cases. Uh, every day, as per the data in the capital, there have been more than 100 cases reported on a daily basis. So we can imagine how the conditions have become like so difficult for these women. Apart from that, since it was for roughly 2 months that the entire country was in a lockdown phase, during this lockdown, there have also been cases where women are not able to even report cases and not able to come up with the kind of harassment they are facing on the hands of their partners or on the hands of their family members. So what is happening basically is that since they're now working from homes, they are pressurized either to leave their jobs completely or to continue their jobs at the cost of their mental health. So I think this pandemic has not only physically impacted them, but mentally, socially. They're not able to convey themselves, they're not able to report cases, and all of these problems have a serious bearing on their lifestyles. There is an increase in the suicide rates in India. There are more women committing suicide because they're not able to cope up with this situation. The loss of uh, the economic slowdown and instability has also affected particularly single moms and single mothers whose only source of income was their jobs. And since now the entire country or the entire world has experienced this slowdown, they are severely impacted. So I think all of these, reading about all of these content, uh, forced me to uh, come up with a presentation like this where we can not reflect definitely in details, but at least reflect broadly about what are the problems, where we can all together put our efforts, how we can deal with this pandemic together, and finally how we can make this pandemic a little more bearable for women in particular and everyone in general.
Mm-hmm. Yeah, that's a very valid point. Thank you so much. We also have a CSC member who has asked a question whether if you foresee the impact of, the gender programs and policies that have been set, that have been implemented a number of years back, and whether there's an opportunity to rebuild these projects and programs with the type of crisis that we're all facing now.
Okay, thank you for this question. Well, there are two perspectives to it. First is a more negative impact of this in the context of the negative impact of this pandemic. So, for instance, whatever efforts that have already been done in the direction of uh, gender development or women empowerment or girls' education, there's a huge risk that these all might get reversed. At the same time, this pandemic also provides us with an opportunity to come up with unique ways to rethink our strategies and to come up with solutions that could well adapt a crisis like situation like the currently that we are having. And at the same time, these solutions can form the basis of our future strategies, that how, if for instance, if we come up with a situation like this again in the future, how we'll be able to save more lives, make lives easier and bearable, not only for women, but also for the wider community. So I definitely agree with the point that we need to rebuild our strategies. We need to focus more in unique terms on what all has been done so far, and we need to come up with different ideas to make this
Mhm.
situation a little more easier.
Yes. So yeah, thank you so much for that. So just to let you know, we've had a few more questions coming in, and I'm just going to summarize some of the questions, if they are, common questions that have come up yet. So moving on to the next question, we have a PhD student from University of Glasgow who is asking, how can you compare the condition of women between UK and India during COVID-19?
Okay.
And
Um,
just to, I mean, I can also ask you the next question if you want to, link it, because it kind of touches upon Commonwealth. So the question is, how can we as Commonwealth scholars do to address these peculiar challenges women face due to this pandemic, especially in the context of developing countries? So I'm guessing you can, maybe merge these two questions to respond back.
Yes. Okay. So thank you for those interesting questions. Well, to touch upon the first question of comparing the situation of women in the UK and India. So, in this context, I haven't read much, but one of the very interesting newspaper article that I have read a couple of days ago talks about an article which says that women in the diasporic communities in the UK, and particularly the Asian diasporic communities, have been severely impacted in terms of majorly the rise in the domestic sexual and gender-based violence that has increased. Also, referring to the general statistics on the rise of violence, domestic violence in UK, there is definitely an increase in the rise of cases. But at the same time, or I should lay it in more simpler terms, that comparing the situation in UK and India, the commonality that has come is in the rise of the domestic violence cases. But since my specialization in the diaspora studies, I was referring to the increase in the domestic violence cases, particularly in the Asian diasporic communities that are residing in the United Kingdom. Linking this question to what we as CSC scholars can do on our part uh, to either create awareness or to provide solutions, I think we have a lot of uh, there are a lot of ways in which we all can contribute, and some of them I think I reflected it in my slides as well. So I think we can all, since we are all into research and research from a development perspective, we can all come up with certain good articles that reflect upon the awareness, that creates awareness um, in our say local communities. For example, I have recently published an article on COVID-19 and its impact on global security, especially in the lives of women, in one of the newspapers in India. So by that, we can at least raise awareness about what is the situation of women in from our country perspective. Apart from that, we can also uh, uh, do some voluntary works by connecting or associating ourselves with some, say, NGOs or civil society groups who are already working in this direction and provide a helping hand. That would be more like doing or providing solutions on the field, because that is really required. And fortunately, I like going through the social media websites, I have come across a lot of CSC scholars who are already on the field, who are already on their fields and contributing and doing voluntary works for the NHS in UK. And similarly, talking about, I know one of the CSC scholar from India who's an alumni, and she is like constantly involved in distributing necessary materials like essential foods, sanitary pads, and all of these things in the communities. So these are certain small ways, but I feel that these can have huge impacts in the lives of the persons who are in need.
Mm-hmm. Yeah, and that is a very valid point. Also, the question in itself is so relevant to the CSC scholarship and the CSC program. The whole point of even having this webinar and the CSC Knowledge Hub groups is so that our scholars and alumni gain the knowledge from UK universities through their studies, through their courses, and eventually go back to your home countries and through your work have the development impact in your communities through your work. So that is such a valid point, and it's so relevant to in the current context as well. Thank you so much, Monica, for responding to that question. We have
Thank
another
you.
question from Jocelyn, who says, how can we help develop a feminist economic recovery as part of their economic empowerment in the post COVID-19 response? For example, how can we ensure governments prioritize childcare and education so that women can participate fully in the workforce? It's a long question. If you want me to repeat, I can repeat the question.
Uh, yes, if you can, please.
Okay, so the question is, how can we help develop a feminist economic recovery as part of their economic empowerment in the post COVID-19 response? For example, how can we ensure governments prioritize childcare and education so that women can participate fully in the workforce?
Okay. Thank you very much for that question. It is definitely a very, very valid point, and I completely agree on this that today governments, specifically our parliaments, have the major responsibility of coming up with policies and frameworks that prioritize education for young children, that prioritize that the setback that females have experienced in terms of financial instability gets recovered in coming years. So, in this context, although uh, I can't comment much, but I can definitely say that there are initiatives. There are very small initiatives on part. There are certain smaller initiatives on the part of the governments, like cash for work programs. So cash for work programs basically generates uh, provides direct cash transfers to the beneficiaries. So at this time, when the entire economy is in slowdown, at least government can come up with small level policy initiatives like this, especially in the rural areas where the means of livelihood have severely affected. And so there I can start with initiatives like cash for work programs and similarly many other initiatives which can provide direct, benefits to the beneficiaries. And in that ways, we can at least for a moment get the economy rolling. And then in future, come up with strong policies and frameworks that would form the basis uh, or that would be based on the basic premises that it is fair in its treatment towards all genders.
Mm-hmm.
I mean,
Okay. All right.
hmm.
Thank you so much. We also have a comment by Mahmood. Mahmood, yeah, sorry about that, who says that in Bangladesh there are 1 million women who are serving as housekeeping, who are serving in housekeeping, and the pandemic hits this community harshly, especially those who were working as on part-time basis. Thank you so much for that comment, Mahmood. The next one is by Joseph, who says, don't you think it also has helped them to be financially stable than men in this period when many people have lost their jobs?
um, Sorry, can you please repeat that
Yes, so
question?
Joseph is asking, because the most affected sector is highly occupied by women, they have higher chances of exposure to COVID-19. But don't you think
Mhm.
it has also helped them to be financially stable than men in this period when many people have lost their jobs?
Basically reflects upon like women being in a more financially stable
Yes,
roles as compared to men, right?
yes. So that's what the
Uh, uh,
question says. Yeah.
yes. Thank you, Joseph, for that question. But somehow, probably I'm not able to understand why will women be more financially stable in amidst such a scenario more than men. If we can, like, it would be really great if we can connect again on our knowledge hubs and discuss this issue. It would be like uh, really engaging there as well. And probably I'll have more time to like read upon this issue that you reflected. So I hope that sounds fine.
Yeah, that's perfectly fine, Monica. And thank you, Joseph, for the question as well. And I do hope that this questions and all the questions that have come up today are continued on the Knowledge Hub, and members of the group, especially those who have expertise within gender budgeting, within the gender space, and the experiences that you have come across within your countries, within your workspace. I do hope and appreciate that these are being shared post the webinar discussions as well. So just a final question from Ogechukwu. I really hope I have pronounced the name correctly. If not, please, I'm sorry about that. And this is something that we have partially covered as well, Monica, but I'm just bring it up again. Thank you so much for your presentation, Monica. May I know how the solutions are preferred? May I know how the solutions you preferred can be made a reality in the present poor economy, where some organizations do not even have enough cash to give out?
Okay, so thank you for raising that really interesting point on this. I would briefly comment and say that is exactly where the role of in partnership or RSDG, Partnership for Growth, comes into existence, because we do have those underdeveloped economies or developing economies who are in dire need of support in terms of financial assistance or in terms of technology, or be it any terms. So that is what I raised a point, that we as a country cannot deal, any particular country cannot deal with this pandemic alone. We need cooperation at local, national, and international levels to support each other. And that is how we'll be able to move out of it. I hope I have answered it.
Yep, that's fine. Thank you so much, Monica. So we do not have any further questions at this moment. And I would like to just wrap up the session, first of all, by saying on behalf of the CSC team, I'd like to thank our speaker, Monika Gupta, for this amazing presentation of the very much needed topic. Given the current situation, given the current crisis that we are all facing globally. So thank you once again for touching upon the very sensitive topic of gender issues, the challenges women are facing throughout the world, be it in developing countries or even developed countries as well. And just speaking about the challenges and the solutions that we can all together work towards eradicating this issue as Commonwealth scholars and alumni. So thank you once again, Monica, for the presentation, and thank you everyone for attending and joining us today.